Hi, Devin. I'm Dr. Tracy.
Hi. Nice to meet you.
Meet you.
I just came in because I was wondering about more birth control methods, and I know it's kind of something for the women, but I was wondering more something that I could do to not get an STD or get a woman pregnant, because I don't want that right now.
Good. I think that's really nice for you to be making that choice, because it does take two, right, to make that happen.
Yeah.
So we are, trying to get more men to come in and talk about family planning, because again, it does take two. And you're right, the choices for men are limited compared to the choices for women. But certainly condoms is one thing that I will encourage you to continue to use if you haven't been already. So condoms are not only going to protect from pregnancy, but they're also going to help protect from STDs. So infections like gonorrhea, chlamydia, hepatitis, herpes, HIV, and HPV.
Okay.
So the other things, however, that I think are good for men to know about is emergency contraception. So there are these pills that your girlfriend or sexual partner can take if your condom breaks or if you have a moment and your condom doesn't quite make it on. And that can help to prevent pregnancy up to 5 days after having unprotected sex.
Okay. And where would I go to pick those up?
Right here.
Really?
Yep.
What would that cost me to pick those up? Because I'm curious about that.
Yeah, so I think that, probably the most relevant way for that to happen is to actually refer your girlfriend to come in. But if she doesn't want to, then, you certainly could come in and get those supplies for her. And it wouldn't cost you anything. Again, if you're part of the family planning program, those services are covered by either C-Care or our Title $10.
Okay, and her parents or my parents aren't going to get told anything? Am I right?
Our services are completely confidential here. Again, I like to remind my young people that I am a mandatory reporter, but all of our services are completely confidential.
When you say mandatory reporter, I'm kind of curious, what do you mean by that when you say mandatory reporter?
Yeah, so many adults in the life of a teen that's under 18 are mandatory reporters. That includes things like your coaches and your teachers, the counselors and principals, a lot of people in your school. And that mandatory reporting is things regarding your safety. So if there are incidences happening in your home or in your life that are putting you at risk, then it's my obligation to make sure that those are being reported and the necessary steps are taken to keep you safe.
Okay.
So then the other thing that I just wanted to make sure that men know about, and that may not be relevant to you as a teen, but could be relevant to you later in your life, is that our program does also cover the cost of a vasectomy. So vasectomy is a procedure that cuts a tube that goes between the testicles and the end of the penis so that sperm can't get into a vagina, basically. So you can't make a pregnancy happen. And that, again, might not be a choice you're making now, but maybe
probably not.
Maybe later after you've had some kids, or maybe at some point when you decide you don't want to have kids. That's a permanent way to not get pregnancy.
Okay. There's no reversal for that?
There is reversal for that, but it's not very good. So we don't consider it to be a temporary contraceptive method. We consider it to be a permanent contraceptive method.
Great.
Thanks for asking all your great questions.